Hello, everybody. Welcome back to another episode of Dr. Charise Show. I hope you guys are having a wonderful week so far. I know the weather, the pollen makes life a little bit more challenging. But welcome again. I am so thankful for your support, your questions, your concerns. So just very thankful to have you joining me as we continue to close that gap in our communities with allergies and asthma. So before we get started, just want to give you that quick disclaimer as usual. This show is not intended to replace the medical advice of your doctor. This show is for general information, so it's not here to treat you, to cure you, or give you false advertisements. It's just all about giving you information to help close that gap in our communities with allergies and asthma. So I got a lot of questions from our last episode. I'm so excited. This is our 4th episode, and I just want to welcome you again and thank you for your support. But I got a couple of topics we're going to talk about today. I know last time we talked really a whole lot about allergies because it is allergy season. So that's one of the big hottest topics right now. So I wanted to give you an update about the COVID vaccine. I am not advocating the COVID vaccine for anyone. I think it is a personal choice that you will have to make and talk to your medical doctor to help make that decision. But I did take Pfizer. I took my last vaccine shot on last Friday. So I kind of want to give you a little bit of feedback about my experience, just to let you know how I felt, what I did, and just maybe those things will be a little helpful for you. And then hopefully you can share some of your experiences too as well. So definitely leave me a message down below, send me an email, just reach out to me. I would love to hear your experience too with the COVID vaccine. I know in my Facebook group, Staying Safe with Your Allergies, I did do a poll just to see how many people actually took the vaccine. Some people say they were excited about it, but they're not really sure they're ready to take it yet. And I understand because it's definitely a personal decision. But I took my last Pfizer vaccine shot last Friday. So I did feel a little tired, but what I did after the vaccine shot, I took a regular Tylenol just to make sure I wasn't having that low-grade fever. Hey, Angela. That's what I did. I just kind of rested because I still had to finish out my work day as well. And then the next day, I kind of just laid around because we had to travel during that time. So I kind of slept. Hi, Tony. I had to make sure, try to get my rest as we slept. We had to travel last weekend. And then that Sunday, I kind of laid around a little bit more too. So overall, I did take Tylenol again, I think twice on Saturday. One in the morning, one in the evening, just to make sure I wasn't going to have any fevers or any pain. So I just suggest, if you do get your vaccine, make sure you do it, time it just right, that you don't have a lot of obligations, so you can just kind of rest and let your body just relax. And just make sure you hydrate. So when I say hydrate, I mean hydrate. I don't mean drink the whole jug of water, but definitely keep yourself hydrated. You definitely want to make sure you probably can take Tylenol if you're not allergic, just to help with that arm pain. I did have a little soreness in my arm all the way into that Sunday, but I say if you move it around a lot and maybe do some exercises, you won't have a problem at all. But I at least wanted to give you, I promise you that I'll give you an update about my COVID experience. It wasn't too bad, just kind of laid around and relaxed, which is always good because that's, a little self-care going there too. But I also want to give another feedback from other people that reached out to me and said that one person took Pfizer, their very first shot, but they had like hip pain, leg pain a little bit, felt a little tired. One person that took Johnson & Johnson, they felt very energized. Another person took Johnson & Johnson vaccine, had no effect at all, no issues. They just took that Tylenol after that first dose. Because, Johnson & Johnson is just that one dose versus Pfizer and Moderna is 2 doses. So, with Moderna, you take it at first dose and you wait 4 weeks before you actually take your second dose. Versus Pfizer, you actually wait 3 weeks, 21 days. So I took Pfizer, but it's all good. I'm doing great, feeling great. waiting for my second week to roll back around because you'll be fully vaccinated after 14 days. So I still wear my mask. Wherever I go, I still try to maintain that 6 feet social distance. I constantly wash my hands. Still doing all those safety precautions, because just because you get vaccinated doesn't mean that you can just stop. Hey, Delon, how are you? So you definitely, when you, even if you get vaccinated with the COVID vaccine, you still want to use those precautions all the time. So it's very important. So just want to make sure I did give you feedback on my experience. And if you had already taken your COVID vaccine, leave me a message down below, or just tell me how your experience went, because I'm curious to find out. Oh, one thing I forgot to tell you, that Saturday, I actually was so hungry for some reason. Could not get enough food. And it was strange because when I was talking to my cousin at the funeral that took Pfizer as well as her second shot, had the same problem. So it's different things, different feedback. Hi, Bonnie, that you will see. People have different experiences, but definitely share, because I would really love to hear what you experienced, the good, bad, and ugly. I didn't have any ugly, didn't really have any bad. So just wanted to see how that went too with you as well. So let's jump in about the whole allergy and pollen season. I know I've been talking about this like so much, but guys, let me tell you, it is so real. So many people are still suffering from these pollen, but pollen is so heavy to the point it's kind of pinning me in the house a little bit. Besides when I have to go out for baseball games, I'm sure, run errands, but definitely, guys, remember all of those tips. If you don't remember, you can definitely follow me on Facebook or Instagram. Even on LinkedIn, I've actually put those allergy tips of the week. I actually combined them last week to make it a little bit easier for you, because I've been doing it every week. But most importantly, remember, wash your hands when you come in. Keep your hands out of your face. Just make sure you come inside, take those clothes off, shower, at least wipe your arms down, your face. Just try to reduce the exposure to pollen. So today I want to switch gears a little bit and talking about asthma awareness. A lot of people in our communities are not aware of asthma, because if you don't realize, allergies ties into asthma. Like we mentioned last week, my son had to take him to the pediatrician because he was outside so much that his allergies actually flared up his asthma. And I know some of you mentioned too as well that your asthma flared up. You had to use your inhaler. Well, we had to go a step further. We had to go with the nebulized treatments, pediatrician, and then end up getting an antibiotic because there was a lot of respiratory stuff going on. He's much better now. I hope you're feeling better too. I know we talked about some different teas that some of you mentioned that you take, that you use, that you like as well. And it's interesting because I ran across a topic today, an article, and it was talking about some of the teas that are really best for asthma. Not to say this is a guarantee, but peppermint tea, licorice tea, green tea, ginger tea with some of those as well. I'm sure that's not the whole list, but just want to give you that quick little tip to you. If you like teas, it does help open up that congestion. It kind of makes you feel good too, because it's nice and warm. Unless you like to drink it a little chill, so everybody have their own preference. So just want to throw that out there to you. But asthma awareness. So it's very important. We talked last week about how to keep those inhalers clean. Always remember to check those expiration dates. But today I ran across another article. Next month is actually Asthma Awareness Month, and they're actually having like a fitness challenge. So definitely check out in my Facebook group or my personal page or business page more information. I'm actually thinking about doing it. So if you're interested, reach out to me. Maybe we can get a team and definitely bring awareness of asthma in our communities. Because one of the problems is there are not a lot of pulmonologists in the United States. So you have a lot of patients who don't go to a regular primary care doctor, or they just go to a pediatrician, or they never get a prescription filled. They don't know how to use their inhaler, or they can't afford an inhaler, or the doctor just didn't give them one. Or just lastly, they don't know what to do with an asthma action plan, or never receive one. So there's a lot of big gap and a lot of education that can go on in our communities, just for letting people know how they can have access to those inhalers. Talking to your pharmacist to learn how to use that inhaler. If you pick up your prescription, I know everybody's busy this time of the year giving vaccinations, but stop that pharmacist and say, hey, can you explain to me how to use my inhaler? If you're not really sure, reach out to me too as well, and I'd be happy. We can hop on a quick call or Zoom call and I can show you how to use it. Or better yet, I can send you a link to a video I already I've done in the past, talk about how to use the inhaler. So it's very important to just bring awareness to asthma, because so many people end up going to the emergency department because their asthma flared up, and a lot of people die because of their asthma. So it's very important to be able to recognize when you're having an asthma attack, or if your asthma is flaring, you start that wheezing and coughing, shortness of breath, that you go ahead and start on your action plan. I'm so very thankful that I knew when my son told me he used his inhaler at his baseball game, that I knew it's time to start on that plan to start the nebulized treatments. And that really helped him to be able to get better faster. So definitely next time we'll definitely dive into more of the asthma. I know this is our big pollen season this year. I just recommend that you always check that pollen count for today, for each day before you head out, so you know how to prepare yourself, because you definitely want to wear the sunglasses or wear your glasses. Try to cover your hair if possible. Just doing the small little tips. Keep those windows up. I know if you have convertibles, you want to let the top down, but if you have allergies, you might want to leave it up. Definitely. So I hope this information was very helpful for you. I just want to give you a personal invitation to join my Facebook group, Staying Safe with Your Allergies. Next month, the month of May, is Food Allergy Awareness Month. So we'll be talking so much about food allergies. Got great things I have planned for the month, just to bring more awareness to that as well. And since it's Asthma Awareness Month too, so a lot of information. So I should be having a webinar soon as well to talk more about those food labels. When you're shopping for different items, when you have food allergies, even if you don't have food allergies, it's very helpful information just to know how to read those labels, to be more proactive as well. And last tip for you today, I want to just challenge you to be an advocate for yourself. When you go to the doctor, ask those questions. Don't be shy. That's what they're there for. If you go to your pharmacy, ask that pharmacist, because they're another resource for you too as well, if you have questions about your medications or different things. And then lastly, you can reach out to me too. We can set up some time. You can get on my calendar and we can try to see what the problem, and we can try to help solve that problem for you. Because my goal with After Allergies is to bring awareness and to help you live easy with your allergies. So thanks again for coming and tuning in today for the Dr. Charise Show. I got so carried away I didn't introduce myself, but I hope you guys do know me. But I do a late introduction before I close everything out for today. I am Dr. Charise Barnes. I'm a pharmacist, a mom, an entrepreneur, allergy expert, and an asthma advocate. And my main goal is to bring awareness and to help close that gap in our communities with asthma and allergies. So stay tuned for our next episode next week. Thanks again for tuning in. And I look forward to your questions. I look forward to your experiences if you're already taking the COVID vaccine. I look forward to you sharing me the different types of teas that you like to drink that helps you with your allergies or asthma. And just share with me your experience with the whole allergy season. I know for us it's been very different this year with everything just blooming. I mean, the flowers are gorgeous, but the pollen they're putting off is a killer. But thanks again. I hope you guys have a wonderful week and look forward to seeing you soon. You can follow me here on Facebook at After Allergies LLC. You can send me an email at info@afterallergies.com. You can follow me on Instagram at After Allergies. And also you can just send me a message here on Facebook. So thanks again. I hope there's great information. I look forward to seeing you next week, and pass the word on, guys. Take care.